the discussion tonight with some specific or better knowledge about Medicare, what it entails, how certain decisions that you might want to make are influenced by the different offerings that are out there. And then, because this is an open forum in a setting that frankly is maybe not conducive to a conversation that's specific about your personal health situation, we'll make sure Larry's contact information is available for those of you who want to engage him separately. But again, without further ado, let me kick it off to Larry Lieb. Larry, I'll let you go ahead and say hello to the crowd and share anything else from the intro perspective, and then we'll dive right into the slides, the task at hand.
Okay, great. Thank you. You hear me?
Loud and clear.
Muted? Okay, great. All right. Thanks, Jeff. Just wanted to start out by saying this is going to be an educational presentation. Medicare defines educational presentations as non-plan specific. So we won't be discussing any particular carrier or any particular plan. You will notice that the material I'm using today is from United Healthcare. There's nothing within this presentation that is specific to United Healthcare. I'm using it today because it's a complete presentation, it's compliant, and they give it to me to use, and a lot of the other carriers don't have something like this. Okay, so it is an educational presentation. I'm an independent agent. I represent a lot of different carriers. We're just going to use the United Healthcare presentation tonight just because it does have, well, it's just because it's a very complete presentation. The one important note is, and this is the odd time of year when we switch from 2023 to 2024 information. And unfortunately, they haven't published the 2024 presentation yet. So I'm using the 2023 one. There's only a couple places where there's any information that's different from year to year, and I'll point that out because we're basically talking about Medicare, not specifically about plans, but there is one particular area that I'll point out where there are some differences. With that, we'll get started, Jeff. Is that okay?
Yeah, it's perfect. Yeah, look, so again, the timing in this is really about focusing on folks in that annual election period, which is now to December 7th, but we know folks who are retiring in January or February, so this will have some relevancy there. And then really, it doesn't necessarily matter. It doesn't have to be your first time hitting enrollment or being 65. We have conversations with folks who are 70, 75, who've been on Medicare 5, 10 years or so. So yeah, Larry, the floor is yours.
Okay, let's see if we can. Okay, you can see that okay?
Looks good.
Okay, good. All right, so this presentation is kind of broken into 10 sections, so we'll cover a little bit of all 10 of these. Basically, what is Medicare, who's eligible, what if I'm going to continue to work past 65, what does Medicare cover, what do I do for getting additional extra coverage over and above what Medicare provides, some things about the cost, choosing between different types of plans, when you can enroll, when you can change, and we'll kind of go through it in pretty much in this order. Okay, so what is Medicare? The red, white, and blue Medicare card. It's a federal program. It comes from the federal government. It's basically funded by taxes that you've paid through the years, all those lines on your, withdrawals coming out of your paycheck. So you've paid into Medicare over the years. It is an individual plan. Okay, so I get a lot of questions about, well, what about my wife? What about my husband? It is individual. So husband, wife, you can make individual decisions on what your coverage is. There's not a family plan. Everybody is handled separately. There's also usually a lot of questions about Social Security. It doesn't matter if you're collecting Social Security or you're not collecting Social Security. Medicare is independent. The only interaction between Medicare and Social Security is Social Security handles the enrollment for Medicare. So when it comes time to enroll in Medicare, you're going to do that through Social Security. Okay. Medicaid there's sometimes some confusion between Medicare and Medicaid. Medicare is the federal program. Medicaid is a state-based program. Medicaid is generally for individuals with lower means right? Lower income. So we're going to be talking about Medicare, but just to point out that if for some reason you or you know somebody that has Medicaid, there are plans that work together to kind of join Medicare and Medicaid together. So if you do have questions on Medicaid, I can work through that with you. But they are two totally separate programs. One's a federal program and one's a state program. Okay. Who's eligible for Medicare? U.S. citizens, you have to have lived in the country for at least 5 years prior to applying for Medicare. Generally speaking, it's for people 65 and older. Those who qualify for Medicare prior to 65 are usually those who have a disability. They're collecting disability through Social Security. After 24 months of coverage, or after being on disability for 24 months, you automatically get enrolled in Medicare. Okay. So generally speaking, 65 or older, or those with a disability, as well as anybody with end-stage renal disease or ALS. You immediately qualify for Medicare if you have either one of those medical conditions. Okay. So we kind of talked about this already a tiny bit, but yes, you can have Medicare and Medicaid at the same time. We call those dual eligible individuals. They're eligible for Medicare and Medicaid, and they can work together. Again, these are special plans. We're not going to talk about them anymore, but just wanted to let you know that they do exist. Okay. Big question. What if I'm going to continue to work past 65? Generally speaking, you can delay enrolling in Medicare past age 65 if you're working and are covered by a large group health plan. So Medicare basically says 20 people or more is a large group health plan, and it's got to be considered credible coverage. So the health plan should be letting you know annually if this if the coverage you have to work is considered credible. It has to do with, is it equal to or better than a Medicare plan? Okay. So as long as you're working, there's no issue down the road in terms of penalties for late enrollment, as long as you have had credible coverage. If you're working for a small company, 1, 2, 3 people, or anybody less than 20, then Medicare says the coverage is not considered credible. At that point, you do need to enroll in Medicare at 65, or you could be subject to a late enrollment penalty down the road. Okay. If you're covered by your spouse's employer, same rules apply. Okay. So as long as you're covered either by your employer's insurance or your spouse's employer's insurance, you can defer enrollment in Medicare past 65. It's usually, and we're going to talk about the pieces of Medicare, basically Part A and Part B. We're going to talk about that coming up. But generally, the advice is, even if you're covered under a group health plan, you should enroll in Medicare Part A only when you turn 65. You can defer enrolling in Part B, but you should enroll in Part A at 65. Part A is not going to cost you anything. It gets you in the system, it gets you your Medicare number, and it's easier then to enroll down the road in Part B when you retire or lose your group health insurance. So at 65, no matter what, you should enroll in Part A. You can defer enrolling in Part B if you're covered under an employer's health plan. Okay, so as I mentioned, there's 2 parts to Medicare, Part A and Part B. Okay, generally speaking, Part A is hospitalization, right? I get my bed in the hospital and whatever services they provide to me in the hospital, inpatient coverage. Part B is covering me outside of the hospital, right? Helps pay for my, doctor visits, tests, procedures, anything as an outpatient. There's a couple things that kind of cross over here. But that's the general definition. Part A is inpatient hospitalization, Part B is outpatient. So we got some specifics here, right? So while you're in the hospital, Part A is going to cover your room, your meals, any kind of care that's provided, any medications that you receive in the hospital while admitted is going to be covered by Part A. Surgery, tests, nursing services, all that's covered under Part A. The other thing that Medicare Part A covers is hospice care. So that obviously is not typically done in the hospital, but hospice is also covered by Medicare Part A. Okay, so I'm in the hospital, Medicare Part A is paying for my hospitalization. Part B is I've left the hospital, or I'm just going to see my local family doctor, right? That's an outpatient service. Part B is going to cover that. Your annual wellness visit, preventative care, laboratory tests, x-rays, MRIs, CAT scans, physical therapy, occupational therapy, mental health care. Do I need a walker, a cane, a wheelchair? All that's covered under outpatient Medicare Part B. Okay. So Part A is provided to you with no additional cost. As long as you've worked the required amount of time, which is 40 calendar quarters, so basically 10 years of work history, you've paid into your Medicare, you've paid your Medicare taxes, you've paid into Medicare, so Part A is provided to you at no cost. Part B, however, there's a monthly premium for Part B, okay? Everybody pays that monthly Part B premium. If you're collecting Social Security, the Part B premium is automatically withdrawn from your Social Security benefit check. If you're enrolled in Medicare Part B and you're not collecting Social Security, they're going to send you a quarterly invoice. You need to pay the federal government your monthly premium for Part B. The premium is adjusted for income. So there's, we just got the numbers the last few days for what the cost is going to be for next year. So your premium for Part B is a 2-year look back. So if somebody's asking, hey, what am I going to be paying? What's my Part B premium going to be in 2024? We're going to say, what was your adjusted gross income in 2022? It's a 2-year look back. Okay. Anybody making individual 103,000 or less, a joint tax return, husband and wife, or married, 206,000 or less will pay the base amount, which next year is $174.70 per month. If your earnings are higher than that, you're gonna adjust upward what your premium is for Medicare Part B. Okay, so 103,000 for an individual, 206,000 for a joint tax return. The base amount's 174.70. It goes up from there. There's 5 additional price points, if you will, or breakouts in terms of paying additional for your Part B. So adjusted for income. Okay. With Medicare, you can see any provider anywhere in the country, right? There's no network of providers. So your card is portable across the entire country, okay? It's important to enroll in Medicare Part B when it's your time, right? So if you're turned 65 and you're not covered under a group health plan, you need to enroll at age 65, all right? If you're late in enrolling, then you're subject to a late enrollment penalty, okay? So it's important that you enroll at the appropriate time. The penalty for the late enrollment penalty for Part B is 10% of the premium on an annual basis. So it can kind of add up, to a significant amount if you've delayed for a while. So it's important to enroll when you turn 65 or when you lose your group health plan. Where it says there, the last bullet item says, unless you qualify for a special enrollment period. So for example, you retire, you lose your group health insurance, that's a special enrollment period, right? So again, you're supposed to enroll at 65, you defer because you're still covered with credible coverage under a group health plan. That's a special enrollment period down the road when you lose your group health insurance. And there's no penalty for doing that because you had credible coverage up to that point. Okay, some of the things Medicare doesn't cover, right? There are some out-of-pocket expenses, deductibles, copays. Does not cover prescription drugs. Vision, dental, and hearing is not covered by Medicare. Okay, long-term or custodial care, not covered. This gets a little into some detail. Excess charges for services by doctors who don't accept Medicare assignments. So some doctors may say, listen, I'm just not participating with Medicare. They can tack on a surcharge up to 15% over and above the Medicare rate. And so that's excess charges are not covered by Medicare. And any care outside of the US. Okay. So I always tell people, if you're traveling outside of the country, if you're on Medicare, Medicare is your primary health insurance, and you're traveling outside the country, you need to get some form of travel insurance to cover you for any medical emergencies outside the country. Okay, so that's very important. I always try to emphasize that with my clients. Okay. So as we said, Medicare doesn't cover everything. All right. So you have two choices for how do I get additional coverage. Okay. The first option, option one, says, okay, Medicare is going to be my primary insurance. And I'm going to get a Medicare supplement plan, secondary insurance, private insurance from companies like United Healthcare or Aetna or Humana or a bunch of different of the life insurance companies, Allstate. I mean, there's a lot of different companies that offer supplement plans. That's secondary insurance to help pay for what Medicare doesn't cover. And then also you need a prescription drug plan. So now you're walking around with 3 insurance cards, my Medicare card, my supplement plan card, and my Part D prescription drug plan card. Okay. The other option is I can combine all of that together into a Medicare Advantage plan. So Medicare Advantage plan, also sometimes referred to as Part C. Basically, Part C is Medicare's definition of if I take Medicare Part A plus Part B, that equals Part C. Okay, so it's Medicare's terminology for combining all your benefits from original Medicare, from the red, white, blue Medicare card, into a Medicare Advantage plan. So the Medicare Advantage plan then becomes one card. You have one card, just like you might have had when you were working and employed. You had one card for your health insurance. That's basically the way a Medicare Advantage plan works. It's one card. It includes all your medical coverage, typically includes your prescription drug coverage, and it may offer additional benefits. You'll see these plans advertised on TV a lot, especially now during the open enrollment period. And they'll talk about additional benefits like vision and dental and hearing. Those additional benefits are typically bundled into a Medicare Advantage plan. So I've got more information on both of these options, but this is basically, you have 2 options. I have more information in the slides coming up, but option 1 and option 2. Option 1 is Medicare is my primary insurance. I'm going to get secondary insurance called a supplement plan to help cover what Medicare doesn't cover. And I'm going to get a prescription drug plan. Or I'm going to combine all that together into a Medicare Advantage plan. Medicare supplement plan, you're going to pay a monthly premium for. Medicare prescription drug plan, you're going to pay a monthly premium for. A Medicare Advantage plan may have a monthly premium. Some of the premiums are $0. Some of them are low, you know, $15, $30. Medicare Advantage plans typically have low monthly premiums, but then you'll have some co-pays for things like doctor visits and hospital stays. This is where we get into a lot of details about individual plans, depending upon where you live, what plans are available. We're not going to do that here tonight. But generally speaking, Medicare Advantage plans are low premium plans. You'll have some co-pays. Just kind of said most of this already, right? It's another way to get your Medicare benefits. Medicare Advantage plans are offered by private insurance companies. So again, companies like United Healthcare, Aetna, WellCare, Humana, they provide the Advantage plans. So when you enroll in an Advantage plan, basically what you're doing is you're telling Medicare, hey, take all my Medicare benefits, transfer them to the insurance company. So now the insurance company is going to be administering all my health benefits, right? Get one card. So now when a doctor, a hospital, any provider puts a claim in for you, I've gone to see a doctor, right? They're going to go to the insurance company, not to Medicare, right? So the insurance company is now the provider of your Medicare benefits. So the plans are offered by private insurance companies. And like I said earlier, most plans offer built-in prescription coverage. So it's one card. And as I said before, most of these plans will offer additional benefits like a gym membership or some dental and some vision built into the plan.
Larry, if I can interject for a second. So I think we talked about this obviously a couple weeks ago leading up to the webinar tonight. Well, is it safer to assume that the Advantage plan, because again, first glance, most people think, oh, a little less expensive, this might be appealing, but it's a bit more of a network focus. So there's more of a need or a requirement to kind of stick within, a much more narrow provider list, right? Like, so again, you're not, hey, I'm going to call this guy for dermatology and this lady for, XYZ. You're really, again, a little bit more contained within the Advantage plan.
So, yeah, I mean, so if we look at the set of providers, right, you're going to have a larger group of providers that are going to accept Medicare. And then you're going to have, some of those doctors are also going to accept Medicare Advantage plans. And then there may be in-network and out-of-network. A lot of the plans today are PPO plans. So the PPO plans have both in-network and out-of-network benefits, right? So there's a lot more flexibility today because of the PPO plans than we saw, 5, 6, 7 years ago when they were mostly HMO plans. Okay. But yes, even within a PPO plan, when you look at what your copays are, typically with the plans, you're going to do better staying inside the network than going outside. But you still have that. If it's a PPO plan, you do have the flexibility of going out of network.
Thank you.
Okay. I think we've covered most of this already, right? All the Advantage plans, they take all your benefits of Part A and Part B, prescription drug coverage, and some extra benefits, and build that into one all-inclusive plan. You still, if you're enrolled in a Medicare Advantage plan, you must be enrolled in Medicare Part A and B. And I get this question a lot. Yes, you still need to pay your Medicare Part B monthly premium to the federal government, even if you're enrolled in a Medicare Advantage plan. Okay. There's no underwriting, there's no medical criteria or exclusions for getting into a Medicare Advantage plan. Everybody's eligible to enroll in whichever plan they'd like to enroll in. Jeff, to your point, may be required to use providers and pharmacy networks in network and out of network. okay, depending upon the plan. The coverage and the cost vary, right? So again, individual plans, Medicare Advantage plans are typically, based upon zip codes. So a plan that may be available in northern New Jersey may not be available in southern New Jersey. A plan in New Jersey is definitely not going to be available in New York or Connecticut or California, right? So there's different plans in different areas. So if somebody's enrolled in a plan locally and then they decide to move out of state, they're going to have to change their plan to a plan that's now available where they've moved to. Okay. All the Medicare Advantage plans have some form of safety stop, an annual out-of-pocket maximum, right? So I'm having a really bad year. I've got a chronic illness. I'm being treated for fill in the blank, right? The plans all have an annual maximum out of pocket. It can vary plan to plan, but they all have some form of backstop, at which point the plan says, okay, you've paid enough for the year and the plan's going to pay 100% from here. Plans may charge a monthly premium. As I said before, some plans are $0 premiums. Most of the plans are low dollar amount monthly premiums. And again, you must continue to pay your Medicare Part B premium to Medicare. Okay. So let's move to prescription drug coverage. There's two ways to get prescription drug coverage. A standalone Part D plan. Part D is Medicare's definition of prescription drug coverage. Okay, so if you hear somebody say Part D, that's a prescription drug plan. So if I have a Medicare supplement plan, I need a standalone prescription drug plan in order to get drug coverage. If I have a Medicare Advantage plan, typically that drug coverage is built into the Medicare Advantage plan. So Medicare drug plans are kind of, they can be complicated to understand. And when we talk about standalone drug plans, there's a lot of different plans in each area. I mean, in New Jersey, I think last year we had close to 30 different standalone drug plans. Everyone's a little different. It's enough to drive you a little crazy, but generally speaking.
And Larry, can I just,
yeah.
It's funny because I didn't realize this, right? This is my naivety in the topic. It's like, I think a lot of folks maybe feel the same way. It's like, okay, I elect a certain supplemental plan. You don't have to use the drug plan that's associated with that same supplemental plan. Nope. It might be my United plan as my supplemental and my hence my drug formulary. So again, I think that's an important distinction to make. And then, in turn, if you have special circumstances, right, individuals with a rare disease or, a fairly regular need for prescription drugs, like, looking at the formulary and bouncing potentially from plan to plan on the Part D side from one year to the next can actually make some sense.
Right. So with a prescription drug plan, a Part D plan, you can change your plan every year. There's no criteria other than I can fill out the application, sign my name. So, this time of year, I get some of my existing clients calling me up and saying, hey, it turns out through the year, my medications changed. The drug plan that we're on, for 2023, is that still going to be the best plan for me for 2024, right? We do an evaluation and say, hey, you know what? I think there's a plan that will cover you better, have lower out-of-pocket expenses. Yes, you can change your plan every year. Okay. Each plan has a different formulary or can have a different formulary. So that's where, we need to kind of look at your list of medications you're taking and find a plan that's going to cover those medications. So medications are assigned to one of 5 tiers. The problem with the tiers is that there's no higher authority assigning those tiers. So a medication can be a tier 1 on one plan, and if you look at another plan, it could be a tier 2. Right? A medication could be a tier 2 on one plan, it could be a tier 4 on a different plan. It's a lot of moving pieces, which is why drug plans get kind of complicated. But the tier 1 and tier 2 medications are typically your generics. Your tier 3 and 4s are typically your brand names, and tier 5 are your specialty medications. Okay, so I spoke with somebody last week who's on a tier 5 medication for a blood disorder. Right, it's a specialty medication. It's got a monthly cost of $16,000. That's the kind of medications you typically see in a tier 5. Okay, generally, the lower the tier, the lower the cost. Okay, so this is where these numbers here are 2023 numbers. We'll talk about the 2024 numbers. Okay, there's 4 stages to prescription drug plans, right? Plans can have a deduct, and by the way, this is defined by Medicare. Okay, so every year Medicare says, here's the numbers associated with the Part D plan for for 2024, right? So every prescription drug plan, every Part D plan follows this format. Okay, plans can have a deductible. They don't have to, but they can. Medicare just says, if you're going to have a deductible, here's the maximum amount you can have for the year. So in 2024, the maximum amount of the deductible on any plan is $545. Now, some plans might exclude the generics from the tier. Some plans might include them. Each plan is a little different. But if the plan has a deductible and the particular drug you're taking is subject to that deductible, you're paying out of pocket, you're paying that deductible until you've satisfied. And then you move to initial coverage, which is the second phase of prescription drug. And in initial coverage, it's kind of worked the way you would hope it'd work, right? You're going to go to the pharmacy, they're going to ask you for a small copay, right? And drug company is going to pay something, you're going to pay something, and everything's great. You're in initial coverage. You're in that stage of a drug plan until the cost of your medication, this is cost. So it's basically let's just say what the pharmacy's buying the medication for, cost. Okay. You're in initial coverage and the cost of your medication hits that threshold, the dollar amount threshold. So there it says $4,660. That's the 2023 number. In 2024, that number goes to $5,030, 5030. That's the threshold. You're in initial coverage till the cost of your medication equals $5,030. You're able to track your cost with your plan, right? Whoever your Part D insurance plan comes from, they should be sending you monthly statements saying, okay, here's the prescriptions we filled for the month for you. Here's the cost. Here's where you are within these 4 stages. Okay, so it shouldn't be a surprise if you actually open the envelope and read the statements that you get from your insurance company. Once you've passed initial coverage, right? You've hit that dollar threshold. Now you move into the coverage gap. A lot of people call that the donut hole. That's the kind of nickname for it, right? So you're in the donut hole. And typically in the donut hole, now you're paying a 25% coinsurance for your medication. So forgetting about what my copay might have been under initial coverage, once I move to the coverage gap, now I'm paying 25%. Okay? And you're in the coverage gap until the threshold for next year is $8,000. So there it says $7,400. That's the 2023 number. In 2024, it's $8,000. Okay, and that's out-of-pocket expense. That's not cost. So out-of-pocket expense is calculated a little differently. So it's not actually $8,000 out of your pocket rather. While you're in a donut hole, there's a manufacturer's discount that's applied to the cost of your medication. You get credit for that. So it's a formula, if you will, to calculate your out-of-pocket expenses. So it's not, like I said, it's not actually that $8,000 out of your pocket. But you're in the coverage gap until you hit that threshold. And then you move to catastrophic coverage. Okay. Most people don't end up in catastrophic coverage. A lot of people don't even end up in the donut hole. Okay. It really depends on the medication. If you're taking, a couple generics for blood pressure, cholesterol, you're never going to get into the donut hole. Okay. For those folks who are on some of the newer blood thinners like Xarelto or Eliquis, those have a little bit of a, higher cost. We typically see folks like that ending up in the coverage gap towards the end of the year. It really depends upon your mix of medications that you're taking. The good news about the coverage gap is any cost sharing that you had in catastrophic coverage in 2023, that changes in 2024. It's now zero. Okay. So as part of the Inflation Reduction Act that Congress passed last year, they made some changes to Part D. So the change we're going to see in 2024 is if you end up in catastrophic coverage, your copay from there is now going to be zero. Okay, so the best example I have of that is, I think I mentioned this just a couple minutes ago. I spoke with somebody who was taking a $16,000, a year, $16,000. The cost of medication was $16,000 a month, and all of this year they were paying. They had a copay every month, because they were in catastrophic coverage because of the cost of the medication. They're out of pocket for the year. Their out of pocket for the year was over $20,000. Next year, because the copay and catastrophic coverage goes to zero, they're going to see their out of pocket is going to be about $3,000. Okay, so for certain people, that really is going to be a huge, change for next year. Their costs are going to go way down. If you've ended up in catastrophic coverage, your costs are going to be way down for next year. So that's really good news. Okay. So again, you have to be enrolled in Medicare Part A or Part A and Part B to be eligible for prescription drug coverage. Most plans have preferred pharmacies. Your copays are typically lower in a preferred pharmacy. So we try to kind of, when I'm working with clients, I typically ask them, well, what pharmacy would you like to use? And we try to see if we can find that pharmacy within a plan that's going to work for them. But these days, we're really seeing the two major chains, CVS and Walgreens, as the two best options for the pharmacy networks, depending upon the plan. As I mentioned, coverage and costs vary by plan, and it can change each year. All right. I see the last bullet item here, the late enrollment penalty. Unfortunately, I see that too often for my comfort. Once you're Medicare eligible, once you're 65, you need to have drug coverage. We mentioned before, if you're covered under your group health plan and that's credible coverage, then you're fine. Unfortunately, I find some people who enrolled in Medicare at 65 said, I'm not taking any prescription drugs, so why should I have drug coverage? Then a year, 2, 3, 4, 5 down the road, they decide, hey, I want to enroll in a prescription drug plan. Well, Medicare says you're not allowed to go more than 63 days without coverage. And for every month that you did not have coverage, you're subject to a late enrollment penalty. So, easy example, somebody was without drug coverage for 12 months. They got a 12-month penalty. The penalty is basically equal to 1% of the national average of prescription drug premiums. Currently, for next year, it's $36 and change. So let's just say approximately 36 cents. So Jeff, 36 cents times 12 months is, you're a finance guy, about $4, right? Okay, so that's going to be your late enrollment penalty. And that's a monthly penalty that you're responsible for forever, for the rest of your life. For as long as you're enrolled in prescription drug coverage, you're going to have that late enrollment penalty. Okay, so that's why it's really important to enroll in prescription drug coverage. in a timely manner. Okay, so just a little bit on, we talked a little bit about Advantage plans. We talked a little bit about Part D plans. So let's just talk a little bit about Medigap plans, supplement plans. I think I basically said they cover most or everything of what Medicare doesn't cover, right? This is what we started about earlier about option one, right? Option one is Medicare is my primary insurance. I've got a prescription drug plan. Now I'm getting supplemental insurance or Medigap plan, right? So we mentioned before, it's private insurance. It works with Medicare to cover some or all of what Medicare doesn't cover. I'm not going to go into all the details of this. We don't really have time tonight to go into all the details, but that's just basically what a supplement plan does. There's a bunch of different plans. You may have heard of, they go by letters. So some of your friends, if they, might have said, I have plan F, or I have plan G, or I have plan N, right? Different plans cover different percentages and sometimes different components of supplement plans. So the plan G is pretty much the more popular plan that I see. If you have more questions on that, I can certainly answer them down the road. But these are standardized plans. Medicare defines the plan, right? They're offered by private insurance, again, companies like United Healthcare and Aetna and Humana. But Medicare says if you're going to offer these plans, these are the plans by definition. So every plan G from every insurance company is exactly the same. Every plan N from every insurance company is exactly the same. They can charge you different rates. One company may charge you X dollars, another may charge you Y dollars for the same plan, but they're standardized plans.
Larry, can I throw a quick question out? I know this is probably going to come up in Q&A later, but so we have a lot of clients who are snowbirds who spend time in New York, New Jersey, and then in Florida or Arizona.
Sure.
Again, I'm painting a very broad brushstroke here, but is it safe to assume, or is it generally better to use like a Medigap plan or a supplemental plan in a circumstance where someone's a little bit more, geographically flexible?
As compared to an Advantage plan?
Yes.
Not these days. The plans have really become very flexible. Most of the PPO plans, the Advantage plans, will say you can use any of our providers anywhere in the country. Okay. So all of the Advantage plans give you some option for I'm a snowbird. Okay. So if I'm down in Florida for 3, 4, 5 months, you're still covered. You may have to notify your plan you're going to be down there, but you're still covered.
Okay.
So,
okay.
Yeah.
Thank you.
Okay. We've talked about, okay, so let's talk about a couple pieces here, right? Jeff and I were talking about this earlier. When you first turn 65 or you first get your Medicare Part B, again, I'm turning 65, I get Medicare A and B. My open enrollment for supplement plans start then. If I've deferred my enrollment in Part B because I was working and covered under a group health plan, my open enrollment will start when my Part B starts, okay? It's a 6-month open enrollment. No medical questions asked, right? Name, address, what's your Medicare number? How do you want to pay for this? And you can enroll in whichever plan you want. 6 months down the road, you may be subject to medical underwriting. If you want to change your plan later on, or for whatever reason, you enrolled in Medicare A and B, but you did enroll in a supplement plan, and a year down the road, you say, hey, I think I want a supplement plan, you're going to be subject to medical underwriting at that time. Except for New York State, which doesn't have any medical underwriting, but everywhere else does. Okay. Once you have a supplement plan, they can never kick you off. They can never single you out for any reason. They can't charge you any more. They can't kick you off. They can't say, hey, you've got a chronic illness, so we have to charge you more, right? And the plan's yours for as long as you want it. Okay, there's no network of providers with supplement plans. As long as the doctor or the provider takes Medicare, the supplement plan pays. Okay, there's no, pre-certification of procedures, or basically, if you set up your supplement plan for, let's say, to pay my monthly premium by automatic deduction from my checking account, you may never have to ever talk to anybody at that supplement company, right? The premium's being paid. Medicare sends, the charges directly to the supplement company for payment, and it's hands off for you. Okay. When can I enroll? Okay, so we talked a lot about this already, right? But let's just clarify. When you turn 65, you have your initial enrollment period. I can enroll in Medicare. It's a 7-month enrollment window. The month I was born, 3 months prior, 3 months after. Okay, that's when the window opens up for you to enroll in Medicare. And as long as you enroll in that window, there's no late enrollment penalty. Okay, you can, as it says, I don't know if you can see, you may refuse or delay enrollment in Part B with credible employer coverage. We've talked about that, because that'll give you a special enrollment period down the road. But if you're turning 65 and you're not going to have employer coverage, you have a 7-month window for enrolling in Medicare. Okay. How do I enroll? There's 2 ways. One is you can call Social Security, make an appointment with them. That's a phone interview. Call them up and say, I want to enroll in Medicare. They say, okay, we'll give you a call back, and, they'll set up an appointment for some future date. It could be, typically it's, 4 or 6 weeks down the road. They'll take your application over the phone and they'll enroll you in Medicare. Or you can go on if you have an account on the Social Security Administration website, ssa.gov. If you have an account on that, you can log in and enroll in Medicare there. That's typically the more convenient way to do things. Okay. The general enrollment period, it's kind of a special case. If you've missed your opportunity to enroll during that initial 7-month window, then you kind of get pushed off. The next time you can enroll in Medicare is during the general enrollment period, which is January, February, and March, the beginning of each year. And typically, if you're enrolling in the general enrollment period, you've missed the window when you're supposed to enroll, so you're probably going to be subject to a late enrollment penalty. We talked about the Medicare supplement open enrollment period. That's that 6-month window from when you first turn 65, or you first get your Medicare Part B. We've talked all through this a couple times already. That special enrollment period for I've worked past 65. You get a special enrollment period when you lose your employer's health insurance, when you stop working. Okay, and again, there's other. The important part about that is, you want to make sure you don't have any gap in coverage, so you're not subject to any late enrollment penalties. Okay, I think we've talked through this. I think we've covered all this already, the late enrollment penalties for Part B and Part D. Okay, when can you change your coverage? Well, that's why I'm working the amount of hours I'm working right now, because we're in the annual election period right now, or annual enrollment period. Every year from October 15th through December 7th, you can elect coverage for next year. And that means for Medicare Advantage plan and a prescription drug plan. Okay, there's no open enrollment period annually for supplement plans. Remember, we said that's the 6-month window when you first enroll in Medicare, or first turn 65. That's the only open enrollment period for supplement plans. But the Medicare annual enrollment period, October 15th through December 7th every year, applies only to Advantage plans and prescription drug plans. The special enrollment periods, like I said, if I move, if I retire in the middle of the year, you can have a special enrollment period to make changes to your Medicare plan. There, for those folks who are in the lower income scale, there are programs. The federal government has programs to help with some costs called Extra Help. There's the state Medicaid program we talked a little bit about. There's the Medicare Savings Program that helps pay for some of your Part A or Part B costs. So you can always call Medicare to get more information for these financial assistance programs. And this is United Healthcare. The MedicareMadeClear.com, that's a United Healthcare website. You can get more information on Medicare.gov. That's the Medicare website, Medicare.gov. Okay. And that's the basics of Medicare. Hopefully, I've answered some questions you might have. It can be confusing. There's a lot of pieces to this. But hopefully I've at least provided you some basics here to kind of help you start out.
All right, this is great. We appreciate you taking the time. I'm going to hit on a couple things, in terms of Q&A. I'm also going to make sure to make Larry's contact information. Bear with me for a second here. I want to just pull up a slide. But one thing that I know Maddie and I and my partner Tom have been doing for the better part of the last couple of years, we've helped a number of clients who are dealing with all of a sudden a surprise right around this time of year. You're getting the notification for what your premium will be for the upcoming year, right? And as we talked about with the thresholds having been increased somewhat, we're still looking at 2 years back for income. And so in the scheme of things, for those folks who have had a significant income back in 2022, that's going to drive what their premiums would be for the 2024 year. So if you are eligible for an appeal, right, there's a form from the Social Security Administration, SSA Form 4, I believe there's the number. It's a pretty straightforward form. You're basically saying, hey, here's my income is expected to be the current year. Here's what it was. Here's why it's changed as much as it has. Specifically triggering events like I had a change in job status. I had some sort of change in marital status, or I had a change in income attributed to some deferred comp or something like that. You can appeal. Generally speaking, the appeal process is pretty straightforward. It's usually about a week or so turnaround time, where you're going to provide that form along with some documentation to the effect of why we're seeing that change one year to the next. The thresholds, let me share those for this year. Bear with me for a second here.
You want all the dollar amounts?
I've got them up here, so I'll just go ahead and show.
Okay.
Hopefully now it's an
There you go. Yeah.
Yeah, so these are the numbers, again, hot off the presses. We'll have some information that's published, on some sort of kind of one pager for clients to have of the new tax rates and whatnot. But you can see, for some folks, they're paying as much as $600 a month. It's couples, right? Here we are, $12,000, annually, and not insignificant, right? So if an appeal is appropriate, let's work through that. One other quick point I wanted to make with respect to the conversation about Medicare, both the supplemental plans and the Advantage plans. Look, Larry's been doing this for a long time. Tonight was designed to really kind of scratch the surface. We acknowledge that in a setting like this, it becomes somewhat difficult to field a ton of questions. But he's more than capable and willing to have those calls. He's talked to people all over the place. I've got some folks in the queue here. I'm going to go ahead and share Larry's contact information in the background, but let me just take down a couple of these questions. And again, maybe I can answer them, or Larry, I'll have you help with those. When is Medicare going bust? Let me hit on that one. So it's I think tongue in cheek, it's the most recent projections from the trust is 2032, give or take, when there need to be some adjustment for both Social Security as well as Medicare. Obviously, it's a political hot potato. We're seeing a lot of back and forth with respect to government spending and the entitlement programs, but I think that's probably a third rail. I think I'm pretty safe to say that. I think you're more likely to start seeing some impact to Social Security and some more aggressive means testing there, but Medicare is likely to be okay for a while. So let me go ahead and address question here. So Larry, it's if you were a retiree, where you had retiree medical from your employer, which will end at 65, in which case you'll flip from the medical plan from your former employer to Medicare. What's the best time, or when is it best to enroll for that Medicare premium takeover from your employer?
Well, if you're losing your coverage at age 65, then you should apply 2 to 3 months prior to your birth month. So, let's say, well, no, so if you're losing your health coverage right around your 65th birthday, right, that's the trigger. So you're going to enroll during the initial enrollment period, that 7-month window, right? So right,
like doing a couple months beforehand versus you can do it in the 3 months afterwards. I think you're playing with fire a little bit there.
Exactly. Yeah.
Here's a good question. Same individual, right? You've paid premiums through your supplemental plan offered through your employer. All of a sudden now you're on Medicare. It happens to be you're in August, right? Medicare look at this stuff with like very little in the way of credit for what you've done. Kind of Medicare's picking up from 0.0, right? Any premium paid or any out-of-pocket medical prior in the year wouldn't go against your Medicare premiums.
Nope. Starting from scratch.
Got it. Great, thanks. Another question here. If you haven't met your RX deductible, but can pay less with good RX, should you use that or pay more to meet your deductible until it's met?
Yeah, I get this all the time. I mean, and so actually, one of my clients I spoke with last night, I think there was 6 medications on the list. 5 of them we're going to put through the drug plan. And then one of them, it's less expensive to get through Good RX. You're free to use Good RX all you want. Yeah.
Got it.
Yeah.
Okay.
But just remember, Good RX is a discount program. It doesn't alleviate the requirement to have a Part D prescription drug plan.
Makes sense. Got it. That's let me have one other one to come in the queue here. Is there a major disadvantage for Advantage plans versus Medigap plans regarding specialty services for serious illnesses, whether it's, let's say, Sloan or Anderson, and let's call it cancer, right, for lack of saying it. So
yeah. So if somebody's coming to me and saying, listen, I'm turning 65, or I'm losing my group health insurance, and I'm in an open enrollment period, and I'm actively being treated for, fill in the blank. In many cases, it's going to be less expensive for you to enroll in a supplement plan and pay that monthly premium, rather than the co-pays you'd have to pay under an Advantage plan up to the annual maximum out of pocket. Typically, and that's mostly what I see is in New Jersey. There are some situations in other states where annual maximum out of pockets are lower. So the answer to the question can be different depending upon where you are, but certainly here in the New York metro area, I would say more than likely, each case is individual, but more than likely, you're probably going to pay less with a monthly premium to a supplement plan than you would the co-pays under an Advantage plan in a case like that.
Look, this is wonderful, Larry. Again, I've got your contact information up here, right, for folks who want to reach out to Larry directly. His phone number, his email address is there. You can feel free to ask questions through us. Again, Larry and I talk usually 2 or 3 times a month, whether we're working on client cases together or just part of our kind of rapport, having consider someone as both personal and professional contact. Thanks for the time this evening. Again, later in the day it can be a bit trickier, but we picked Tuesday night, so we didn't interfere with your Monday night football schedule. Thanks for tuning in. We'll have the event recorded for those of you who want to go back and look at the slides. And then again, feel free to share this with anyone who was unable to make the meeting tonight. Thanks so much. Take care.